NIECR, the Northern Ireland Electronic Care Record, is a comprehensive patient record that allows healthcare professionals to see all the information relating to a patient in one place, in a single view. It means they don't have to go in and out of multiple different systems to get that clinical view of the patient, and they're then able to drill down and get more specific information. So it interfaces rich clinical data from a range of downstream systems all in one place. NIECR, since it was launched in 2013, has integrated and interfaced a whole range of systems, and we are still continuing to interface more systems into NIECR. In recent years, we have gone beyond just interfacing into other systems, so NIECR has become a source record in its own right and has introduced some additional functionality, such as an electronic referrals and electronic triage solution. So within the GP practice, for example, the GP can raise a referral through to the acute setting, and in the acute setting they use NIECR to triage that referral and then progress that through. Also functionalities such as radiology order comms, so you can order or request radiology tests from within NIECR that then gets processed through other downstream systems also, but it prevents the healthcare professional having to exit one system and enter another system. We've also done a lot of work recently on healthcare pathways within NIECR. There's a range of pathways, probably most notably is our diabetes pathway, which has been very successful and very well received. So those types of functionality and additions to NIECR have brought NIECR beyond just being that interface patient record. It's also now has some of that tool set within it and additional functionality that allows healthcare professionals to do much more than just view the information. eReferrals have obviously been involved with NIECR right from its inception. It was a very, very close working relationship in those early days. In fact, eReferrals were actually embedded, their team were embedded with the core NIECR team, so it was essentially one team. And since then it has been continued very much a partnership approach, where we as a customer would have a range of requests and requirements that come through our user groups, and then we would bring those to Orion and work collaboratively to design the solution around those requirements. So it's they have helped us evolve the product as our needs have evolved from within our clinical community. Extending NIECR beyond the acute setting, for example, or beyond what might be perceived as more traditional clinical roles, is really about putting the patient at the centre of what we do. The patient interacts with much more than just clinicians in that acute setting. So to allow people who are involved in all aspects of the patient's care is very important to us, and that's why we want to promote the use of NIECR to other areas outside of what might be perceived as the traditional setting. It has been said, eyes are the windows to the soul. Eyes can be a great window to your health and a great indicator of health. So giving NIECR to the optometrists has enabled the optometrists to be more connected to that wider health delivery network and be able to give the patient the best treatment and the best advice, and also to interact and share in a much wider network of healthcare professionals, so they can easily then refer on to the relevant other healthcare professionals. They can give the patient the best advice. Sometimes the patient may not always be able to articulate some of their issues. So again, with the optometrist having access to that information, they can fact check and they can make sure that they're building up that proper view of what the patient's needs are and the best treatment path for that patient. Some of our future plans for NI-ECR would include interfacing with more systems. There's always more systems that we could potentially interface with, so we have a long list in that regard. We also have other areas of functionality that we'd like to bring in, like additional pathways. But we would also like to expand NI-ECR through use of our patient portal, for example, which has been a very important aspect of that. And we would also like to push NI-ECR out into other groups similar to the optometrists, but to widen its use amongst that wider clinical community or healthcare professional community. And also potentially to bring in the independent sector more into this, into use of NI-ECR in a bi-directional sense, because again, the patient may choose to receive their treatment through a range of different settings, but having access to the appropriate clinical data is important, and regardless of which setting they're in. So those are just some of the plans we have for NI-ECR, and we are very pleased that there is that growing interest and that expansion of NI-ECR, and we continually grow in terms of the number of users within NI-ECR, which is a testimony just to how useful and valuable it is to our clinical community.